So this slide is simply a picture of or cartoon of the anatomy. And at the top in the neck, you see the arrows pointing to the anterior scalene muscle. The middle scalene is hiding behind it. And then you can see the clavicle, and you can see the first and second ribs, and you can see the pectoralis minor muscles that run from the ribs to the coracoid process of the scapula on either side. And I think if we then look at this a little more closely, in the figure on the right side, you can see where it says A, there's a space between the anterior and middle scalene muscles. And you can see the nerve roots from the cervical spine passing between those. Then at B, you can see the clavicle, and below that is the neurovascular bundle. And below the neurovascular bundle is the first rib, so that the neurovascular bundle passes between the first rib and the clavicle. And C is the pectoralis minor muscle, and the neurovascular bundle passes between the pectoralis minor muscle and the thoracic cage, or if you will, it passes underneath, below the pectoralis minor muscle. And this anatomy is helpful in understanding the concept of true neurogenic thoracic outlet syndrome, where nerves are entrapped. There is a vascular thoracic outlet syndrome that we're really not going to talk about, that where the compression is in either the artery or the vein, but not so much the brachial plexus. There is a traumatic form of thoracic outlet syndrome, which is really caused by a fracture of the clavicle with the malleus, which causes a large callus to form that compresses the brachial plexus. And finally, there is a disputed, which is everything else, if you will, including what I call myogenic thoracic outlet syndrome, or thoracic outlet syndrome of muscle origin.